My name is Tamitha Ratliff, Morehead State University, NURB 461. The movie I've chosen for my analysis is Patch Adams. It's a 1998 comedy drama film based on the life story of Dr. Hunter Patch Adams. It features Robin Williams as Patch Adams, Harold Gould as Arthur Mendelsohn, Bob Gooten as Dean Wilcott, Monica Porter as Corinne Fisher, Daniel London as Thurman Smith. There's actually also several other well-known actors in the movie, but the main character is Robin Williams as Patch Adams. And the movie begins probably late 1960s with Robin Williams on a bus. We're not sure, what's going on with him. He acts distressed, distraught, kind of troubled. He ends up showing him at a mental institution where he has committed himself for trying to commit suicide. Once he's there, he meets different kinds of patients. Some, are screaming loud, hollering. Some are just sitting there in like a catatonic state. He does recognize the one gentleman, which is Arthur Mendelsohn. He's a really wealthy, well-known, almost genius type person. Then it shows him going and meeting his roommate Rudy, who they explained to him hasn't been out of his room or the bed in weeks, because he's, we find out, afraid of squirrels. So, one of the main things that stand out to me in the movie is his first therapy session with the therapist. And, he's talking to the therapist, expressing his feelings and how he's feeling, what's going on. And the therapist is just kind of like sitting there. He's taking notes, but it's almost like he doesn't even hear what Mr. Adams is saying. Like he doesn't care, almost. Like he's just writing to be writing. He says, ask him a few questions here and there, and, Patch will answer them. And he actually also gets that feeling. Because one of the last questions he asks him, he is answering it, but then he gives him this crazy off-the-wall response at the end. And the doctor really doesn't even catch it. He's just kind of like, okay, your therapy session was really well. And then, he's kind of shocked. It kind of he shows shock on his face, like he didn't even hear what I said, Another one is when they're actually having group in his room a little later on, because Rudy won't leave his room. The therapist is there. Some of the other patients are there, and they're wanting to know why they're having group in the room. And, he's trying to explain because Rudy won't leave his room. There's actually one gentleman there who sits, he does not speak, does not move, doesn't do hardly anything, actually doesn't do anything. Sits with his right arm held straight up, just like, you raise your hand to answer a question, be asked to answer, ask a question. So the doctor is doing his usual thing, just jotting notes down, really not paying attention, seems like, to anybody. And, of course, Mr. Adams starts cracking jokes like, who needs to go to the bathroom? Raise your hand, and some of the other ones, the patients are giggling and snickering, and some of them are joining in like, well, who needs to do this, or who likes this? Raise your hand. Well, the doctor doesn't like it, and, makes a comment about it, and he gets up and leaves. I don't really feel that they were making fun of him, because it actually shows them kind of a close-up, and it almost looks like he actually has a little grin on his face, like he's thinking it's funny, too. So I think he's just mainly using humor to try to break the ice, like, hey, look, pay attention to us, Another part of the scene there is still in the mental institution that that comes to mind that, I think about a lot is when Mr. Adams actually goes to meet Arthur. He goes to his room one evening. Arthur's sitting there, he's just writing away, taking notes, just jotting down different things. Looks almost like mathematical equations or something. There's like a cup of coffee sitting on them, and it's leaking. And Mr. Adams sees that, so he walks over, and kind of picks it up. They speak a little bit, not a lot. And he gets a sticker and actually puts on the side of it to make it quit leaking. And that's kind of where he gets his name Patch, because Arthur, the character Arthur, looks at him and calls him Patch, and then, holds his hand up. He can tell he's a little different, that he's kind of maybe there for the same reason he is. That it's not just, all mental issues. He may have a few problems, but he understands, So he holds his hand up and is like, how many fingers do you see? And of course, Patch says 4. And he tells him, no, look past that, look past what's right in front of you. Which, to him, he's trying to say, look at the whole picture. Look at like a whole person, the mind, body, and soul. Not just look at their body. What's wrong with their body, the disease-wise. He really starts thinking about that, and it helps him in another scene later on with his roommate, who needs to go to the bathroom, and Rudy won't get up and go because he says there's squirrels at the foot of the bed. So Patch starts pretending like he's shooting them with a gun. And long story short, after they go through flipping over beds and everything else, Rudy makes it to the bathroom. Patch actually gets into the bathroom, something that's not happened in probably months. And that's all about looking past what's right in front of him. He looked past just, seeing fake squirrels. Rudy seeing fake squirrels. He looked at Rudy as a whole. And this makes him start thinking about using humor to help people, especially since he's able to help some of the guys, people there, some of the guys in the institution. So he checks himself out. The next thing you see is a few years later that he's enrolled in Virginia Medical University. He's like the oldest first-year student. And it shows him in, like, the main one he meets his roommate, which is Mitch. He's really younger than him. And Mitch is kind of taken back by his age. But he's like, okay, So they all show him in the auditorium, one of their first classes with Dean Wilcott. And he's just telling them how things are there, and you don't go into the hospital until your third year and different things. And Patches can't believe it, he's like, it's kind of a cold clinical type of thing. Like, they can't believe how cold and just clinical they are with their patients, And, that's why the dean says, you treat your patient as a patient. You don't bond with them. It's kind of what he's saying. And Patches is not that way. He's like, you need to see, treat the person as a person and treat their disease. So they kind of clash because they don't see eye to eye. One thing that comes to mind, too, about treating a person as a person is that he sneaks in with third-year students and ends up, kind of hanging behind, watching them around. And they come to this one lady who's in the hallway laying on a gurney. And looks like she has a really bad big toe, foot on the right foot. And they're talking about diabetes and things like that, and the professors question them and what they do. And it's like she's not even there. It's like they're not even acknowledging her. They're just talking about her and about her disease. And all of a sudden at the end, towards the back, Patch says, what's her name? What's her name? And everybody kind of steps back. And the professor has to look and says, it's Mrs. Such and Such. And, as they walk on by, then he acknowledges her. He lets her know, somebody cares. You're not just a disease, because your big toe's rotting off. You're a person. Don't feel like you're not. Then it shows him a little later on, he ends up in, like, the children's ward, which it appears that all the kids possibly have cancer. Several of them, don't have hair, and it's kind of dreary and drab, and they're all just laying there. And he starts talking to this one little girl, and he takes, like, a bulb syringe and cuts the end off and sticks it on his nose like a clown nose. And starts acting silly and uses, like, cotton swabs and puts behind his ears, act like some kind of animal, Or he has a glove over top of his head, blows up for the balloon for another child. Well, they're all giggling and laughing and think it's funny. Of course, he gets caught. He's not supposed to be there by the dean and the head nurse. Well, the dean's really upset, and because he is not following the rules. And, could be expelled, different things. And actually, he does come down to trying to expel him after another incident. He didn't like him anyway, but he did choose him to help lead or prepare for an obstetrical conference. GYN's coming to the university. So he tried to get some of his friends that he had met, which Corinne was one of them, and Thurman, to help him, which, they all thought he was a joke. They tried to have study groups. He just made jokes and cracked, jokes. I don't want to say they didn't like him. They just didn't like his, not really attitude, just didn't like how he chose to do things. They were all kind of by the book, and they thought that he was just making a joke of everything because he's trying to use humor. So he was like, he did it all himself. He's like, he didn't need them help for the conference. Of course, he gets in trouble because he makes two large legs, puts on the outside of the conference, and the door is the vagina. Dean Wilcott about died when he brought the gynecologist around to where the auditorium was. Needless to say, they going to expel him. He actually had to meet with a higher up dean, and this guy was like, just follow the rules, just do what Dean Wilcott says. you seem to be a fairly good doctor. Let's not get in trouble, things like that. So he agreed, and they let him stay. And also, after all that, he had made friends with Corinne and Thurman. And he had expressed to them about what his ideas were. His main idea about all this was he wanted, not that he was funny and didn't care, he wanted to develop like a clinic that looked at the person as a whole, that they treated the people, using humor and compassion and really listened to them, not just what was medically wrong with them. So it actually come down that he got back in touch with Arthur, the wealthy gentleman he met in the institution, who owned a lot of land, like 105 acres of land, and had a small cottage on it. So he actually takes Corinne, who he really likes. She's not too keen on him in that situation at first, but takes him out. He takes her out to like the edge of this cliff and shows her all this like forest area, and she's like, "What is this?" So he tells her, "This is where, my clinic's going to be. This is where I want to do all this. This is, where we want to build this clinic and treat people." So she explains to him that, where he came up with it, the 105 acres and who it's from. And there's actually a cottage there that they all help renovate, even her and Thurman. And they help renovate, and they offer, care to these patients, free medical care. It didn't matter what it was. It wasn't necessarily medical. Some of them, they just needed somebody to talk to and things like that. There's a gentleman that they actually met that came to the clinic that Patch had met in the hospital clinic, or ER, who came in one time. He saw him. His name was Larry. He had some mental issues. He actually, self-mutilation, he cut. And one of the professors explained to him, who he was and everything. Well, this Larry actually ended up at their clinic. Of course, Patch welcomed him in. He got Corinne to trust not only Patch but Thurman, but also to show compassion, that there was nothing wrong with showing compassion. Long story short, Corinne ends up at Larry's house, and he kills her and himself both. Well, this makes Patch question life, question the goodness of humanity. Should he really not, be believing in all this goodness and things like that, questioning God. He's actually shows him back out on the cliff where he first took Corinne to show her the forest. And what all he wanted, explained what he wanted to do. Well, there's a butterfly that he believes is her. Comes back to show him hope and like she was there, wanting him to don't give up on your dreams. That bad things do happen, but it's okay. Continue what you're doing. In like her honor. So he decided he was going to do that. Well, actually, the college ends up finding out that supposedly he's been practicing medicine without a license, running this clinic there on this land. Take him, they expel him. He actually calls Mitch his roommate, even though they didn't get along really well, but he knew he needed to turn to him for help. So Mitch helps him, tells him, file your grievance with the state medical board. And have your case reviewed. So he does this. Actually, as the board is reviewing his, case and asking him, did you do this? He actually admits he practiced, yes, I did, practice medicine without a license, but it wasn't just medical. It wasn't all medical stuff. That there's some of it, was treating just their mind, their body, their spirit. Part of his speech that really stood out to me when I very first saw this movie when I was in nursing school was, listen to your nurses. Learn your interviewing skills early. Things happen. People do die, but it doesn't have to be in vain. Let them die with dignity, but treat them as a person. So they actually reinstated him. He ends up graduating. Of course, at the end, he walks across the stage with just his cap and gown on, and moons Dean Wilcott and the whole audience. But it was worth it to him, and I think to a lot of other people. But now I can remember watching this movie when I was in nursing school, and like I said, that's the main thing that stuck out to me was treat your person as a whole person, not just their disease. They're people. You got to remember that. Sometimes it's hard not to remember that, and you want to focus on treating what's going on, but remember to treat them as a person. You'd want to be treated as a person. to me, it's like the holistic nursing, holistic part of medicine. And that's what I keep trying to remind myself and to remember as I do nurse, is just treat the person as a person. Understand what's going on. Sometimes it's underlying things that are causing some of their physical symptoms. So, sorry if I rattled on, rambled. Hope you enjoyed my review. Thank you.